Uncontrolled hemorrhage remains the main cause of death for civilian adults under the age of 40 and the leading cause of death on the modern battlefield. 80% of preventable battlefield deaths are due to bleeding and is consistent in studies from the recent conflicts in Iraq, Afghanistan, and Ukraine. Following the conflicts in the Middle East, servicemen and women have been issued with better ballistic protection, but hemorrhage still accounts for a large proportion of potentially preventable deaths. Stopping a life-threatening bleed can challenge even the most experienced medics. Help is often too far away, or the casualty bleeds to death before help arrives. In some situations, life-threatening bleeding can lead to exsanguination in under 5 minutes. CELOX is proven to stop life-threatening bleeding fast and is trusted by militaries, emergency services, and healthcare professionals worldwide. When a wound is hemorrhaging, blood escapes from the circulatory system at the wound site. The body then attempts to stop the hemorrhage via the intrinsic and extrinsic clotting pathways, which results in the formation of a stable clot. Patients who have suffered major blood loss are at significant risk of becoming coagulopathic, a medical condition that causes the body's natural clotting mechanism to become ineffective. CELOX chitosan technology works by absorbing the fluid of the blood, forming a robust gel while concentrating the red blood cells and plasma to create a robust mechanical gel-like clot that plugs the bleeding source. This is further supported by mucoadhesion, which keeps the plug in place. Studies support that CELOX works independently of the body's natural clotting cascade and has been shown to work even in the presence of clotting dysfunction. Some other hemostats on the market work by accelerating the body's clotting cascade, which may become compromised during major blood loss. CELOX works independently of this process. CELOX is designed to help stop life-threatening bleeding quickly and reliably. Mode of action: gauze. When CELOX gauze is applied directly to the site of bleeding, the granules on the surface of the gauze absorb blood and fluid to form a robust gel-like plug, concentrating the red blood cells and plasma to create a robust mechanical gel-like clot that plugs the bleeding source. Between the layers of the gauze, the granules absorb fluid to create a physical gel barrier. The gauze exhibits a level of mucoadhesion to the surrounding tissue, which keeps the gel plug in place. The gauze exhibits adhesive properties between the layers to prevent movement and help maintain the plug in place, creating an environment which allows clot formation under the gel plug. Evidence and extensive clinical experience demonstrate that CELOX provides rapid and effective control to help stop life-threatening bleeding. CELOX stops life-threatening emergency bleeding. CELOX gauze improves survival. CELOX Rapid works with just 60 seconds compression. CELOX works independently of the body's classic coagulation pathway and does not generate heat. CELOX is made to help save lives.